Hi, my name is Tavita, and I'm a certified orthotist, prosthetist, and practicing anaplastologist. And hopefully, I can do a walkthrough of maybe a test question, but this is not a real test question. This is a practice test question for you, and I hope this really helps you. I already have a few things highlighted. There's the 30-year-old female seen post knee disarticulation. Now, knee disarticulation, as you should already know, is when they amputate right at the knee. So you still have the condyles. They are weight bearing most times. Sometimes, all the patients that I've ever seen with knee disarticulation, they can generally weight bear. And that does help with the prosthesis that you'll be providing for the patient generally. Generally. Of course, there are other cases where if it was something like a PFFD, and a PFFD, sometimes the socket inside of the hip joint is sometimes a little bit shallow, or maybe the neck is underdeveloped and it's a little bit straight, and so it kind of goes like that a little bit more, and so it's not as stable. And then you would actually want to do an ischial seat right where the ischium is, so that way there's weight bearing through the ischium. But that's not knee disarticulation caused from anything. That's usually a birth defect, and sometimes they would do something like a rotation plasty. You can look up all these terms by yourself. I'm sure you already understand it, and if you want to look into the book, you can. I'm pointing at the book over there. Use the book. So a 30 years old is better than having a child, right? A child or a kid. There will be a new device being made every year, or sometimes twice a year, twice within the same year due to growth spurts. It's a female that's 30. Chances of her going to grow are very slim to none. I would just say none, because usually those plates are matured by then. So you know that it's new. Post knee, so post just happened. Then when you get the exam, you'll have all of these questions to ask the patient. It should have all the information that you need in order to create a device for them. What are things to look for when making a device? You have to make sure you know which side is it, left or right. Okay? Because that's something you see. Find the question that gives you the right or left first. I'm just going to give the answer. It's get the x-rays from the orthopedist. When you get the x-rays from the orthopedist, they generally tell you what side it is. So right here, we're just going to hear from the orthopedist. Articulation. All right. Whatever you do not hurt the patient. Range of motion manual muscle testing seems like a great answer. Just wait, okay? Let's go through more questions here. Getting x-rays. Great question. What's another one we could possibly ask that wouldn't be touching the patient, but you'll just be asking or talking to the patient? Ask the patient what her goals are. It's a good one to ask. Recommend the patient walk. Okay, and what's the cause of your amputation? It's a good one to ask, right? Nobody's getting hurt. Nobody's being offended. It's not an offensive question. Tell her she has to give up on her job. Okay, so this one's a really bad question. You would never ask this. So we'll just put next here. On the exam, you won't be able to write anything on it. If you click on the screen, it's going to be permanent and it's going to lock in. So I recommend not doing that. I recommend just getting a piece of paper, which is the piece of paper they give you, and a pen, and writing down 1 through whatever amount of questions during the examination, which is the Dominion 1. If you look on the file from the last video I did, Dominion 1 will have all this information. But anyway, so Dominion 1, if you click on anything during Dominion 1, which is like that first section, it will stay, it'll populate, and it'll be there forever. So the next one is perform lower extremity range of motion manual muscle testing examination. You don't want to touch a patient yet. Remember, you can use your eyes and ears, and then we'll use your hands. Pain level, super important. What do you do for a living? Prosthetics will look just like your normal leg. We know that we do not set improper expectation. Put an X on number 8. Make sure you don't click 8. Recommend the patient to walk on one leg. We do an X because that's not for you. Physical therapy can work with them, and they can work on devices and assistive devices. You will not be doing that. Your job is to get rid of the leg Ask the patient if you can examine her residual limb. Is what we call physical. So this is touching. So let's just wait on that and get a smaller shrinker for the patient. That's a physical thing that you're doing to the patient. So we're not going to do that one either. One thing would be, are they diabetic? Do they have dialysis? Dialysis can change the volume of a patient's limb drastically. So what's a way that I can ask all these questions through one question? One good way, at least through this exam, what's the cause of your amputation? This can help you better identify what caused the amputation to help eliminate some questions or some variables. One variable would be diabetes. So what was the cause of her amputation? Motor vehicle accident. So we can assume, not safely assume, but we can assume that she doesn't have diabetes. We can assume that it was just caused from a traumatic accident and they had to amputate her leg. Now, next question. Ask the patient what her pain level is. Okay, this is a good question. What do you do for a living? What's your occupation? What do you do every single day? Construction. She's a construction manager. Walking most of the time. On dirt and hills. Okay? So she's walking in dirt and hills. That means that we can go from K0, K1, 2, 3. That's K3. But obviously, she was just amputated, but this could be a possibility. Now, what can make it so that we know for sure that this is something she wants to continue doing? Goals. That will help us understand if that's what she wants to do. So let's ask her what her goals are. Go back to work. And run. And also hike. Boom. Now we're in the K3. Because this is what she wants to do. If you look at the K levels, it's also what they want to do. Their goals are actually a part of what you can actually identify what their K levels are. Give them shrinkers. That's not one of the underlined ones that we're going to go after, but ask the patient. We did that. Ask the patient what their pain level is. So then she says, no pain, but in my shoulder. You hurt. Okay. Okay, so this is just an example of getting an answer through a question. So now you definitely wouldn't want to do range of motion of the shoulder, right? 100% wouldn't want to. Then right here, now right here, ask the patient if you can, this one's going to be important, ask the patient if you can examine the residual limb, and then manual muscle testing right here. Bada bing, bada boom. So if you ask a patient if you can examine the residual limb, if you examine the residual limb, or perform range of motion manual testing. So I would examine the limb first, just to look at the skin, and then do the range of motion manual muscle testing. Okay, so let's do that. See, no. So the sock is just falling off. Just no abnormal skin. There, I'm just going to say it like that. But you know what I'm saying. So there's no redness, no soreness, nothing like that. So that's a big positive, right? So we know that it's closed. So the wound is healed. And no signs of ears. You know, like those little ears that you get if you're amputated and those corners start to stick out and it kind of looks like a little box. I might do a little picture. Boom, this one. Yeah, so no ears. But since there was no shrinker lines and it didn't seem like there was a lot of compression, then out of all this, what thing would you do? You would probably get a smaller shrinker. That's all you have to do. And done. We're just going to say done. Bingo, bango, boongo. Everybody's happy. Okay. I'm really happy with this. So what did we learn? We got a 30-year-old, right? Age, knee disc or tick, motor vehicle accident, and within functional limits, also manual muscle testing. Everything was 4 or 5, strong. And since she has a full range of motion, you know, recovery is going to be a lot better. Do is maybe go through physical therapy, it's like prosthesis to strengthen the amputated side. This is actually for just Dominion 1 of the section, which is this one. This is just an example of how you answer questions systematically using your eyes, using your ears, and then using your hands last. And you can see by this method, it seems very slow, but if you practice it, it's actually very, very fast. And you can get your questions done quickly. I finished my exam an hour early, just waiting. Actually, I didn't wait that long. I just kind of left. I was really scared. But I left an hour early or so. And if I can do this, this is a very slow way of doing it. This is just my thought process through Dominion 1, which is the first section, which is evaluation. And there are a lot of other questions. If you want me to go through Dominion 1 again, I can with another example. And the next one, I'm going to do Dominion 2, which is the section 2, which is the coming up with a device and building the device. And I will also be doing lectures on K levels, prosthetic device choices, and all those other things. So if you want help with your board exam, I hope you can just stay tuned. You can subscribe and just follow me so I can help you just get better. I just noticed that there's nothing about prosthetics, like how to take the test, what to look for. Just comment down below, like and subscribe. And any other questions, just please let me know. I have time. I would love to answer your questions. All right. Until next time.